Which medical practice have you speaking?
There's a direct quote. You said, "I feel alive again."
And I still do, because I'm not drugged up to eyeballs.
It's hurt all the time, you see.
Has something like this happened before?
No.
Sharp scratch, sorry. Tell you what, Nathan, I've had bigger boys cry when I do this.
You don't like doctor, you don't like to wait.
It's easier to get into heaven than getting to see a doctor.
I've got to enjoy life.
Enjoy life and don't let this hold you back.
No.
Come in. Hello, is it Victor?
Yes, it
Hi,
is.
Victor. Come in. You're looking very smart.
Thank you.
Is that for my benefit?
Oh, yeah.
Go and sit down. Right, how can I help?
Well, yesterday I was going down to pick up my little brother from school, and when I was walking down, I started feeling a sharp pain, lower right side of my abdomen.
OK.
So every time I put weight on my right leg, the pain started coming more and more.
Sure. OK.
For the first time, I didn't go to football, which is...
OK.
Yeah.
So that's a big deal, is it?
It is, yeah.
Fair enough, yeah. And is the pain there now as well?
Is.
OK. And how would you describe the pain?
Kind of piercing towards, like, some of my bones, I'd say.
Yeah?
Yeah, just the top there, just at the front.
Any nausea, vomiting?
No.
No? Going to the toilet OK?
Going to the toilet a lot.
A lot,
Yeah.
OK. Do we have a feel of your tummy? Do you want to just come up on the couch for us?
Yeah.
Are you worried it might be anything in particular?
My mum said that it could be something with the appendix. I just thought it was a bladder.
Yeah, yeah.
So...
Well, it's around the same place as your appendix, so it's something we need to rule in or out, really. So just relax, head back, nice and relaxed. If you just point to where you're getting the pain.
It's right there.
Around there. I'm just going to start on this side.
Yeah.
Is that sore?
Yeah, there.
About there. OK, that is sore, isn't it? OK. I'm just going to check your pulse. And if you had to describe the pain, kind of 1 to 10, where 10 is the worst pain you've ever had, what would you say?
It's probably like an 8, but...
8, OK. I'm just going to have a listen into your bowels as well. That all sounds fine. Do you think you'd be able to give me a water sample?
Water, yeah?
Yeah?
Yeah,
Come on, then.
Take a seat, my love. Who's this lovely lady? My mum. Right, what can I do for you today?
My throat is really sore and hurting.
She gets sore throats all the time. I just don't bring her every time because, you know...
I've had a look and see about a tonsil, you know, when we've seen her with it. Are you ready? Temperature first. Has she had a fever?
No, not that. No. She's only been like it since weekend.
Right.
She came home from Dad's at weekend and said, do you know, my throat's really hurting.
Are you good at opening your mouth really wide?
No.
Have you got a cough or anything?
I have it
On a night I've heard her coughing, yeah.
Open wide. Big R. This torch is brilliant.
Put your tongue down.
Bigger than that. Come on.
Do it.
Ah.
Open your mouth, Claw.
Good lass. Right, so looking at her, temperature's fine. Her tonsils are very, very big tonsils, but there is no tonsillitis at the moment. OK, so I've looked at her record and she had a nasty tonsillitis in July. She was poorly, wasn't she?
Yeah.
This, I don't think, is a bacterial infection. I think it's a viral infection. It goes with a runny nose and a bit of a cough. When you get to about 12, 13, your tonsils often start to shrivel down.
Right.
A lot of adults don't have any. We look in the throat and we don't see any tonsils, and they've never had the tonsils out. They just go.
Yeah.
So I think we can plod on at the moment. Plenty to drink. Paracetamol. You know, if she gets hot and poorly, or you'll know, because I know you're a sensible mum. She's sensible, isn't she, mum? Most of the time, eh?
Yeah.
So you know where we are if you need us. Keep plodding on. Get a bottle of water.
That's what I told you, just keep hydrated.
You young ones, teenagers, they don't drink, do they?
No.
You need to be drinking constantly. Drink now while you can. Me and your mother will be running to the toilet every 5 minutes when we drink a lot.
Definitely.
All right, my love. Is that okay?
Yeah, thank you very much. Thanks.
Bye-bye.
Bye-bye.
Any joy?
Yeah.
Perfect. Oh, plenty. Right, come and sit down. Seen in your records you're from Malawi, is that right?
Yes.
Yeah, how old were you when you moved?
I was 5.
Were you? I did some work in Malawi, actually, in Blantyre. I did some voluntary work in a hospital over there for 6 months.
Do you remember the name of the hospital?
I want to say Queen Victoria or something.
That's where I was born, I
Was
believe.
it?
Yeah.
Yeah?
I believe that's where I was born.
There you go. The urine is absolutely clear, but that rules out a urinary tract infection, but it doesn't rule out appendicitis. The only real way to find out is to send you into hospital for them to do some blood tests and a potential scan and keep an eye on you. I'm going to give the hospital a call. I'll tell you exactly where to go. It'll be the Bradford Royal Infirmary. Do you know where that is? Yeah. Okay. Hi, can I make a surgical admission, please?
Did you always want to be a GP?
No, not really. When I was younger, I wanted to be a vet. I don't really know what happened. I applied to do medicine instead. I think my mum was a deciding factor in that. And then I thought about doing paediatrics for a long time. In fact, when I was in Malawi, I was working in paediatrics, which I really enjoyed, but then I missed adults and conversations with adults and that kind of thing. And with general practice, you get the best of both worlds. You see children, you see adults, you see a bit of everything. Hi, thanks for taking my call. My name's Amir. I'm a GP calling from the Ridge Medical Practice. Hi, I was wondering whether you might be able to take a look at an 18-year-old chap for me who I think might have appendicitis. Started yesterday, gradually got worse, describes it as 7 out of 10 in severity. Otherwise fit and well, yeah, hardly ever comes in. Thank you so much for that, I appreciate it. Cheers, bye-bye. Yeah, they're happy to see you up there. I'll just give you this to take. I would go home, tell your mum, pack an overnight bag in case, and then go to Ward 20 at the hospital. There you go, Victor. Best of luck, mate.
Thank you.
All right, thanks for coming in. Cheers. Don't forget your jacket. Nothing to eat or drink until you've seen them.
All right, that's fine.
All right, OK. Cheers. Take care, mate. Bye.
See you.
So what's happened today? School's rang me up about 1:30 saying she's had an allergic reaction to something, but we don't know what.
OK. And she's allergic to nuts, isn't it?
We know she's allergic to nuts. Then they've given her erythrodine. They said she had problems with the breathing. She got wheezy.
OK.
But she's quite blotchy around her face.
Itching as well. Do you remember what you've eaten? No.
What she has said is there was children having chocolates on the carpet.
OK, so...
That's the only thing I can think about.
Let's have a look at you. When did you pick her up?
I've just picked her up about 15 minutes ago, but she is getting more blotchy.
Since then and now, do you think that this is a bit more different in what she has been, right?
Yeah.
OK, let's have a listen to your chest. Do you stand up for me? Can you lift her top up, Mum?
Yeah.
OK, have a seat. Her skin is red, her cheeks do look red. In case, like, you know, it became a full anaphylactic reaction, we're going to call the paramedics like a 999.
Anyone else waiting to make an appointment?
Peekaboo. Ready?
Ready?
Oh dear, that were a big sigh, weren't it? Can you say a big R for me?
Say ah.
Stick your tongue out.
Thank you. Thank you.
Listen at your chest.
That's big.
That's because I've got a big head. OK.
Is it ticklish?
Ticklish, aren't they?
Oh, hiding.
Where are you hiding, hiding?
Come on, are we going? This doctor's got more patients
Hello.
to see. Come on, I know you're special, but you're not that special.
You having a relax?
Bye, everybody.
Bye-bye. See you later.
Right, thank you.
Cheers.
Bye-bye. Come in.
Hiya there, come in.
Hiya, thank you.
Oh, is this little Louise?
Yeah.
Come in. I've got 2 students with me as well, if that's all right today.
Yeah, that's fine.
Thank you. How can we help?
Well, I came on Monday about downstairs because she's very sore and it's just got worse. It's spread around her bum.
Oh, poor love. Is she sore?
Yeah.
So this problem with the nappy rash has been going on for how long now?
About a week now.
Right. Could I have a look, do you think? Maybe if we take her coat off and just have a look. She's all right on your knee, though. I don't want to upset her. You're a good girl, aren't you? I like your shoes.
Very tired, aren't you?
Got a Minnie Mouse on your shoes. They're pretty.
Oh.
So she's in nappies?
Yeah.
Yeah.
I know.
Good girl, I'm going to stay over here. Oh, dear.
All right, darling.
Oh, bless her.
She's really sore, though. I don't know if you can...
Yeah, I can see. She is really sore, isn't she?
And it's like that at the front as well.
Yeah. Let's just have a look at the front.
I'm going to put this mask on your face, OK?
Ready? There you are.
Is that OK?
Is that okay?
Yeah.
Yeah.
Pretend we're not looking at you. When was the last flare-up?
It's been a couple of months now.
Yeah.
We don't know what's actually triggered it today.
So, a trip to hospital in an ambulance? Yeah.
Thank you very much for coming.
Thank you so much.
You're welcome. Good luck.
It's nice and steady.
Take this off you once we get outside, yeah?
Once we go outside, OK.
Thank you.
Thank you.
Thank you.
Take care. Hope everything gets...
Thank you very much.
Nice and slowly.
Cheers. Thank you.
Sometimes when mine have been really sore when they were little, I used to use like Dipper-Base cream on a cotton wool bud and just use that to wipe, moisturising cream, but to wipe and just clean, you know, and avoid water completely, because water can be an irritant as well sometimes. She didn't look 100% actually, but I suppose if she had a jab...
She's been throwing up all last night.
Yeah, should we check your temperature, little lady? Should we check Mummy's first? Let's put this in Mummy's ear. Are you ready? Wait for the beep. Are you ready? Beep. Did you hear that? Look, Mummy's okay. Should we check?
Mummy's not got a temperature, do
Should we get Mummy to do it?
Mummy, do it, look.
You just press the button down on the top.
Come here. Just let me get your ears.
Good girl. Good girl. Perfect, thank you. There, that's okay. Get that nappy off when you're at home. Fresh air's the best thing sometimes, just to help heal. Right, Dipper-Base.
What's up, baby? Are we going to go buy some puppy food?
Oh, have you got a puppy?
Yeah, we just got one yesterday, didn't we, for yours and your sister's birthday?
Got a doggy? You're mad. So how many? So what have you got them? A puppy?
It's a
Oh, just one?
Yeah, just one. It's a star.
My husband wouldn't let me have another kid, so he settled on a dog, and I am sure another child would have been so much easier than a dog. So you're going to be running after Piddle from the little one with a nappy off, and you're going to be chasing the dog round. I can picture it now.
And then I've got a 2-year-old.
Running through it all. There you go. See how you get on, and if she's not getting any better, bring her back.
Come on then, shall we go then? Yeah. Do you want to go get some din-din? Stop picking your nose. Well.
Take
See
care.
you later.
Bye-bye.
Thank you. Come on then.
Hiya. Yeah.
You just love to keep women waiting, don't you?
Well, ask my wife. I stood her up on our first date.
Well, do you know, nothing surprises me with you.
Look at her now. She still loves me.
Is it... I was thinking your wife's the Dr. Amy?
Dr. Amy, yeah.
We met at Leeds University, didn't we, back in 1999, Freshers' Week.
Yep. Random pull in Majestic's nightclub.
And we got married in 4th year at medical school.
We've got 3 children, and we've worked together for about 8 or 9 years.
Do you know, I was shocked, actually. And I said to Neil, I went, I could have imagined him with, right, dolly birds.
She's a dolly bird. She's gorgeous.
But she's an intellectual dolly bird.
She's gorgeous.
Quite a lot of the patients like the fact that they know us as a couple. I think it helps them to relate to us as individuals.
That definitely helps, yeah. And
we get lots of questions about how are the kids and the dog and...
Yeah. And you can share your own stories and people relate to you as a family and a couple, and I think you can...
Makes you feel more human rather than a doctor.
Absolutely. Right then, down to business.
Yeah, I'm glad I've got to see you, really, because I saw you in January, didn't I? And we left it where I was going for the injection down my leg, which I had.
Did you?
Yes.
Yeah.
And it's been amazing. But things have deteriorated since I saw you. It started a couple of months after I'd seen you because we were doing pretty well.
I'm just reading through what I'd written and there's a direct quote. You said, "I feel alive again."
And I still do because I'm not drugged up to eyeballs and I haven't gone back on the medication no matter how.
So it was right to dig meals in one time.
Shall we give him that one, love?
Yeah, I'll take that one.
Right then, what's been going on?
What's happening is I've got earache.
Yeah.
And I'm telling my teacher at school it's hurting, so what they've done is put a hot compress on me.
Okay.
But it was still hurting.
What's he had for the pain so far?
Calpol.
Does that help a little bit? A little bit. And tell me about this, you've just been sick as well?
I was just thrown up everywhere out in waiting
Were you
room.
sick before this or not?
No.
This is just the first time. OK, so your ear was just hurting at school. It was all right when you went to school this morning, was it?
Yeah.
Yeah. OK. Right, let's check your temperature and then we'll have a good look, see what's going on. It's your left ear that hurts, is it?
Yeah.
OK, well, let's pop this in this ear then.
Yeah, Jaden.
Anyone else been unwell in the family or just you?
Just me.
Just you. OK. Right, let's have a look in your throat and then we'll look in your ears, OK? Just go, ah. Oh, well done. You're very good at that. OK, so your throat's fine. It's not that. I'm going to look in your good ear first, the one that doesn't hurt, and then we'll look in the one that does, all right?
What? No, you can't have no more. Look at it, Jaden's getting his ears done. Look at that. Yeah. Yeah.
Do you mind standing up for me to look in the other one? It'll just be a bit easier. Good lad. Oh, yeah. Oh. OK, have yourself a seat. He has got an ear infection, OK? The right ear looks completely fine, but the left ear's really red and looks really angry in there, OK?
Right, okay.
So the current guidelines are that you give really good, regular pain relief for the first couple of days.
Right.
Because it's causing him such a lot of pain, I can also give what's called a delayed prescription. So I give you a prescription today for some amoxicillin.
Right.
And if that pain relief that you're going to do isn't settling things down, or if he gets any discharge from that ear, then you start the antibiotics. Does that sound
Right,
okay?
yeah, that's perfect.
All right. We try to avoid antibiotics wherever possible because most infections are viruses anyway, and then you don't want to take antibiotics for a viral infection because it won't do any help, and it can cause other problems as well as antibiotic resistance in the longer term.
That's absolutely fine. Grab your sick ball, darling.
All right then. Okay.
Thank you.
All right then. Okay, you're welcome. Get well soon then.
Thank you.
Bye.
Bye. Come on, Jesse Joe. Thank you.
All right, bye.
It's not extreme agony where how it feels, the only way I can describe it is, you know when you've been kicked and you've got the worst bruising ever?
Yeah.
That is how it feels.
Right.
And even when I just bend slightly, I feel as if my skin's been stretched.
Yeah.
And it's awful.
We do see that. It's called allodynia, and it's where you almost feel pain from things that would not ordinarily give you pain, bed sheets rubbing over something, like loads of things that's nervous system related. We don't... you change your position.
Yeah.
Do you want to perch on here?
No, I'm all right. I'm going to stand.
There's often not an easy solution to it other than all the other ways that we try to manage your chronic pain. You still, even though you feel that things are worse since I last saw you, you're still a damn sight better than when I first met you.
Because I'm not drugged up to eyeballs.
Yeah,
That's why, Doc.
Yeah.
You love that, don't you?
I do, yeah.
Some painkillers for long-term pain can actually be quite unhelpful. In short term, they're effective, but in long-term use, we find that, firstly, you can develop quite nasty side effects. Secondly, we find that the painkillers become less effective over time. And thirdly, and importantly, the longer you use some of these painkillers, they actually have an effect where they help you to feel pain more rather than take the pain away.
OK, so I think we know where we're at, and we've started some of the really important stuff, which is to reduce some of those drugs and make you feel human again. Would it be sensible to see me when you're at the point that I might have a go at some of the other drugs?
Just because you'll miss me, won't you, if I'm gone? 'Cause I am your shining star.
Well, there is a bit of that as well. Right, so when you're ready, come and see me.
Brilliant.
All right, anything else?
No, that's fine.
All right, good.
Thank you.
Bye.
See ya. Might as well go that way, haven't we?
Because I feel like,
Hello. Are you a film star?
Am I a film star?
Of course she is, can't you tell?
Yes. She's so beautiful.
Oh, thank you. Oh, thank you. How can I help?
Right, what can I do for you today?
I've been coming to this surgery over 55 years. I went to the optician. They gave me eye drops because my eye are scratched. Now they have stopped the eye drops.
Who have?
The doctors have.
Is it one of the GPs or one of the doctors at the hospital?
The GP.
Oh, right, OK.
GP has stopped it.
Right.
Now, if I was to buy them, it'd cost over £11.
I see.
I'm a pensioner. And I'm nearly 80 years of age. I'm lost for words. If I was to go blind, it'd cost a lot more.
Morning, my dear.
Hi.
You look good for 70 years old.
Are you a granddad or a...
11 grandkids.
You've got a lot of reasons to look after yourself.
You're only 65.
I know.
You're a young whippersnapper.
I've had 2 new knees, so I did a lot of walking.
And that's why you don't look 80, you look British, you look very good.
What's your date of birth?
2nd of the 2nd, 30.
I wish I was as old as you.
I wish I was as old as them, to be fair.
You're not as young as I expected.
You look a lot younger than what your age says.
Forgotten is supposed to be retired.
Youth is wasted on the young, isn't it?
Thank you very much, Rosemary.
OK, see you in October.
Will do, love.
If I was to go blind, it'd cost a lot more.
Oh, we don't want you to go blind, do we? When was the last time you used them?
I use them every day.
Right.
I don't like coming to the doctors and wasting their doctor's time over drops.
If you need to come, you need to come, really. Isn't it?
I don't like coming. That's the thing.
And what's the reason for that? Is it you don't like doctors, that you don't like to wait?
It's easier to get into heaven than getting to see a doctor.
Now, Patrick, it seems like... You're smiling. Right, it seems like you went to see your optician, yes?
Yeah.
And when you were there, your eyes were tested by one of the ophthalmologists. So they were thinking that you might have what we call a glaucoma.
That's right. Now I remember. Yeah.
Now you remember?
Yes, I do.
So it was basically those people who'd stopped it. They said you didn't need the particular ones that you were using at the time.
My eyes get irritated if I stop using them.
Yeah, yeah. But, Patrick, does it affect your ability to see? Does it affect your vision at all?
It does.
Do you think
if
it does?
I don't have the eye drops, yeah.
Right, OK.
I know there's cutbacks. I know that.
Right.
But I only take 3 tablets a day.
OK.
And
now,
I'm over 55 years coming here.
Of course you are. But it's nothing to worry about. Now that you've come here, right? OK, and I see you still need your drops, so I can restart you in those drops, can't I?
That's marvellous. Put it back on again, please.
Yes. So I'll put that back in your repeat prescription.
It's very good of you to see me.
It's all right. How is everything else?
Well, the last time I was here, I had blood pressure, which was high. And it's higher today.
Do you think so?
Definitely.
Can I have a quick check?
Yes.
Let's put that on. Let's put that here.
How am I?
Your blood pressure's absolutely fine.
Am I all right?
Yes, you're absolutely
That's
fine.
a miracle.
Hi, Nathan. Come in. Hi,
Hello,
Dr. Khan.
hi.
Nice to see you. Hello,
Hiya,
Dr.
hiya,
Khan.
hiya,
Nice to see you. Come and
you.
sit down. Great. Okay. And you came in just last week, wasn't it? And you saw Dr. Caris.
Yes.
And he said you got something called a pyogenic granuloma on your back. Tell me about it. How long have you had it for?
About 2 months now, and I didn't really notice when it started. We were just in bed when it started bleeding.
Do you mind if I have a look at it?
Yeah.
Have you still got that dressing on?
Yeah.
We can take that off. Right, sorry, it's not very nice taking stickers off. Oh, yeah, OK, fair enough. It does certainly look like a pyogenic granuloma, yeah. Do you know what that means? Take a seat.
It's known for bleeding regularly.
Yeah.
It's traumatic skin into that can't overheal or something.
That's right, yeah. So it's usually caused by a nick in the skin or something like that, and then it doesn't heal properly and it forms this over the top of it. It should come off quite nicely.
Good.
Yeah. Usually they're on a little stalk and we take them off right from the root. The only bit you will feel, Nathan, is me putting in the numbing medication, the anaesthetic, and that's a little needle underneath it. It'll sting a little bit as the medicine goes in. After that, you won't feel anything at all.
You're not bothered, are you? Just want it off, don't
You want it off? Fair play. Right, OK, so we probably need that shirt off. Is that all right with you? Yeah? Whitney, will you help Nathan just onto the bed? Are you OK to watch, Mum? You're a nurse, aren't you?
Yeah. I'm not a nurse, I'm a technician, but yeah, I'm all right. Yeah, I'm brave.
There you go. So you just like to lie down on your front on here.
Be brave, Nath.
Are you nervous, Nathan?
Not well.
No, good lad.
Will you send it away then?
We send everything, yeah. Normally within 4 weeks you'll get a letter saying it's what we think it is. It's very occasionally it turns out to be something that we weren't expecting, but they tell us that pretty quickly.
Yeah.
So, right, so I'm just going to give it a good clean, Nathan. It'll just feel a bit cold and wet. Do you like school then, Nathan?
It's all right.
It's all right. OK, so we're going to put a bit of the medicine in now. This is the worst bit. After this, nothing at all. Sharp scratch, sorry. Good lad. Didn't even flinch.
You okay?
Yeah.
Tell you what, Nathan, I've had bigger boys cry when I do this. So you're doing well.
Right, Patrick, how can I help?
Both my hands are slightly swollen.
Okay.
Both my ankles are swollen as well. Feet are swollen.
So tell me how it started. What happened?
It just came on one day. My knuckles were a bit sore and no bruising came up. But then it started swelling.
Okay.
And it's hurt all the time, you see.
Right.
And I'm thinking whether it's arthritis, because my runs in my family.
Okay. So something like this happened before?
No.
Never?
No, I suffer from gout.
Yeah.
But not on my knuckles like this, not for this long time.
And this time it's both hands as well?
Yeah.
Because gout tends to usually involve one joint.
That's it, yeah.
One side.
She wants her right puffy and I can't grip.
Yeah, okay.
You can't squeeze anything, you know.
Okay. Yeah, are both hands same or one's better than the other? Okay.
Same,
right.
yeah.
And you mentioned arthritis runs in your family. Do you know what sort of arthritis is it, or...?
Osteoarthritis.
Osteoarthritis.
Grandmother, she had all fingers all...
Okay. Let's have a look then.
Those two are the most sensitive ones.
These two, yeah. I can see a bit of swelling there as well, isn't it?
And in my knuckles as well, you know.
So...
That's sensitive there.
This one is sore. Okay.
And that one there, yeah.
That one there as well. Okay, let's have a look at this one. And the problem with your ankle, it started at the same time as well?
Yeah, it started swelling. In fact, it was worse than that, slightly going down.
Okay, can I check your blood pressure as well? Have a quick listen to your heart and your lungs. Have a listen from the back. Just breathe in and out for me. And again. Okay, thank you. Right, so looking at your hands and joints, obviously, I mean, we know they're swollen and they are sore, okay? I mean, we've talked about osteoarthritis, which is more wear and tear. But with this kind of presentation, what we worry about is a different type of arthritis.
Right.
Okay? Something like rheumatoid arthritis. Have you heard of that?
Yes, I did. Yeah,
Okay.
yeah.
And that is kind of arthritis where your own body kind of starts attacking your joints and things. And usually it happens in the small joint of your hands. Okay. So I'll give you some medications to help with the pain and swelling. Okay. And we'll arrange for some urgent blood tests. Okay. And then we'll see you back with the results of the blood test.
Okay,
Does
fine.
that sound okay?
Yeah,
Right?
fine.
No
Yeah.
worries. I'm going to give you a short course of naproxen. You take 1 3 times a day for 2 weeks. Okay. There you
Thank
go.
you.
All right, thank you very much. Take care.
Bye-bye.
Bye.
Good afternoon, the Ridge Medical Practice, Veronica speaking. Hello, can I help? Hello?
I'm supposed to be going out on Saturday, this Saturday. We're doing like a brunch thing where you pay 25 quid and you get brunch and you get unlimited Prosecco for about an hour and a half.
Shut up. Anybody home?
And mojitos.
Mojitos? Oh, I've heard rumours about them. They're supposed to be nice.
Oh, she's gone.
So we expect it to bleed a little bit as I take it off. That's not unusual.
What are you doing this weekend?
Playing football.
Oh, yeah.
Do you play for a team?
Yeah, I play for Westwood.
Oh, okay.
And I just started staying for Bradford.
Have you? Yeah. That's pretty good, isn't it? It's got a really loyal fan base, hasn't it, Bradford City?
Yeah, because they're not doing very well at the minute either.
No. It's up and down with them, isn't it? That's the thing. My sister is the Bradford City doctor. Yeah. So she might see you. Well, hopefully not. Right, should we put that in the pot?
Yeah.
It's off.
Gosh.
There we go.
You all right, Mum?
Yeah, I'm fine, yeah.
We're nearly finished now. They go pretty quick, don't they, Nathan, these things? Right, should we have an absorbent dressing, similar to the one that he had on before? Yeah, that's fine. It's come off beautifully.
Good.
There'll be a little black mark where it's been. It'll scab over, fall off a couple of weeks, and he should have a nice, healthy kind of... Might have a little white patch, but nothing more than that. Looks
So do I
good.
need to keep it covered then now? Or not?
Keep it dry for 48 hours,
Yeah.
and then you can take that dressing off in a couple of days, and it should be fine.
Fab.
Cheers, Nathan. Well done, mate.
Thank you.
How can I help?
Since, well, Saturday when I woke up, I felt like I got hit in the head by something. I'm very disorientated.
Yeah.
My throat glands over here, they're all swollen.
Yeah.
When I wake up, it's like I'm severely dehydrated.
Mhm.
My tongue's just like sandpaper, literally. And I don't know if you can see my fingers as well. My fingers became like that. And then this finger, all the pus has come out of it today because I bent it, but I can't bend it. Now I'm all right because I've been taking paracetamols and ibuprofen, but I've been waking up every 3-4 hours at night because I need to take stuff because my back, my waist, my legs, even last night, I rang my brother, he was only in the next room, I woke him up and I said, please just go downstairs, I can't even get up. I need painkillers.
Yeah.
I've not been able to go work for the past, this is the 3rd day I've been off now as well.
Okay.
I've got a picture actually of my hands as well. You'll be able to see yesterday.
Is your throat still really sore?
Yeah. I don't normally take pictures, but
Okay.
you can see.
So were a few like that with that sort of pustule?
Yeah.
Like that, just appeared. Okay. Do you work with any
chemicals or anything like that? What do you do?
I'm in IT.
Okay.
I work for an agricultural company, so they do develop chemicals and stuff.
Right.
I don't know if
You don't get involved with touching chemicals?
I
though,
don't get involved with touching the chemicals, but I am in the plants and the labs.
Okay.
And then on Friday, I was in a few labs. I don't know if it's something I may have breathed in.
I spoke to 111 and they told me I have to come in straight away.
And what are the symptoms?
Oh, I've got a very, very sore throat.
And I also feel maybe a little bit feverish.
Chesty. Do you actually coughing up?
If you just take a gulp for me.
I feel like my throat is swollen, not sore.
Stick your tongue out and say ah. Ah. Say ah. Yeah.
Cough. I feel my throat all sore.
Anything else with it, or just the sore throat?
A cold?
Yeah. You've got a bit of a blocked nose, I can hear it, yeah.
When I kind of blow my nose, there's a kind of a funny feeling in my ear.
It's so painful that I can't even, like, touch it.
It's constant.
Every time I swallow, I get, like, the headache.
What we're going to do with you, eh?
That's fine. All right. Nice to know. I'll keep an eye on you, honestly, until we sort you out. Thank you. All right.
Appreciate it.
Oh, yeah. It's red, isn't it? Yeah, that looks pretty sore. I'm just going to relax and say, ah.
Ah.
There's some white spots going on back there, too. OK, and you said you felt it painful under here. Let me see if there are some glands.
Oh, yeah.
OK.
Yeah, right there. I don't know if you could feel it.
Is that painful there? Yeah. I can feel those. They're not huge, but they might be painful. Yeah. And these have all kind of almost gone, as you say, still a little bit under there. You need an antibiotic for tonsillitis, pharyngitis there, and I'll give you something that will just finish treating what seems to have been an infection with these pustules here, OK? Are you allergic to any medicines that you know of?
Only penicillin, but that's when I was a kid, I don't know.
OK, no, it's all right. What I'm giving you is what people who are allergic to penicillin would have anyway, so that's quite good. So all these other symptoms, like the aching all over, the eyes feeling heavy, feeling hot and cold, leg pain and everything, it's probably all related to the infection that's caused that throat. It looks like what we call a strep throat, streptococcus, that's caused that infection, and that can cause quite nasty infections, sometimes even nausea, vomiting. In terms of work, you know that you can self-certify for up to a week, so just keep in touch with work like you have done, and you probably won't feel quite up to going back for a day or two. Hopefully the antibiotics will work pretty quickly, and when you feel able to go back...
to work,
yeah, OK, good. OK. Right.
OK, that's
all right?
All right, thanks for your time.
OK, then.
See you later.
Bye-bye.
Bye.
How can we help?
I'm having blackouts. It's like I feel really down, and then if I eat something sweet, that's okay. The energy comes back a bit. But some days it's like yesterday, I couldn't even get up.
So just describe to me what happens.
I don't have to be doing anything, and my heart kind of sinks, and then I just completely get a black. If I'm not getting a blackout, I'll definitely need a drink or something, something sweet, and then I'll come back. But then it's like my brains are half as. It just takes time. Or like yesterday, I had a complete blackout.
So you get a sinking feeling in your heart,
Yeah.
and then do you feel a bit faint?
Yeah.
Yeah. And does it come on suddenly?
Yeah.
You also said you've been feeling a bit down.
Yeah.
You're feeling fed up, low in mood.
We've had 2 funerals. My both uncles have passed away.
Oh, I'm sorry. Who's at home with you?
My children.
Just your children?
Yeah.
You don't have a partner?
I'm a widow.
Yeah, yeah. Should we check you over?
Yeah.
So?
I went to hospital on Monday and saw Dr. Shaper, I think, or Mr. Shaper.
For your legs, yeah.
And I'm just freezing. If you feel me, I'm just absolutely from top to... It's just like ice.
Yeah.
And he doesn't think he can do anything for me.
Did he say what he found? Did he say they were abnormal, the pulses or anything?
No, he said they were all right. I'm sure he did.
Well, it's ruled out one potential cause for it. So the blood flow to your legs, the big blood vessels, the ones that carry the pulse, are OK.
Oh, good.
So that is good news.
Oh, that's brilliant.
It doesn't mean that the tiny, tiny blood vessels that go to your toes and to your fingers, they could still be...
I mean, just feel my hands.
They are cold, aren't they?
My feet are cold.
I remember, yeah.
I'm so fed up.
OK, that's good. So there's no drop in your blood pressure when you stand up. You didn't feel dizzy then when you stood up? No? Good. So with any of these do's, is it usually when you're sitting and watching TV, or have you actually fallen to the floor?
I have never fallen to the floor, to be honest.
I wonder if you're a bit low and fed up in mood and whether or not this is contributing to some of the symptoms you describe. But you also tell me that you crave sugary drinks. Part of that may be because you go in fairly long periods of time not eating very much, yeah? But a few things I'm thinking right now. I think we should check your bloods. I think we should check them for anemia, and I think we should do the diabetes blood test as well, just to make sure that there's nothing medical underlying this. So let's do those blood tests. Let's see you back again with the results. In the meantime, try and get some good sleep, good rest. Try and get some exercise in the day, so fresh air, doing some walking, yeah? But I also want you to think about your diet as well and eating perhaps more regularly. You don't have to eat big meals, but just eat a bit more regularly, OK? OK, there we go. Ask at the front desk if you can have a blood test.
In here, is it?
Yeah, and let's see what it shows.
That's fine.
All right, my love.
Thank you.
Take care.
Thanks a lot.
Bye-bye.
Bye.
Amy, I'm going to put something to you, and it doesn't mean we're going to do this, but I just want you to have a think about this. What would happen if we never got to the bottom of all of this stuff? How would you feel?
I want to finish my autobiography.
We're all waiting for that autobiography.
You know, so I've got to... Sometimes I sit and I think to myself, I'm just lazy.
You're not lazy. You've got some symptoms that are very real and are getting you down. Sometimes when we investigate patients with multiple symptoms like this, often they're very real, but we don't know why they're happening. It might be getting to a point where we say, we've investigated it all now and we've seen people, and there are some things that we are doing for the eyes, the joints, but some of the other things may be a case of, right, I know I've got this, I have to learn to manage it. I've got this book to write, and I can't let these things stop me anymore.
No, I'm strong, I can.
You're very strong. You've been through a hell of a lot, Amy, in your life, haven't you? That's why you're writing that book.
I have, love.
Yeah.
I've got to enjoy life.
Enjoy life, and don't let this hold you back.
Now, what do you think, girls?
Doesn't that sound good? Yeah? Right, so I'll send you out an appointment to see me in a couple of weeks.
I don't know how this doctor puts up with me.
Oh, no, I like it.
Anyhow, all the best, and bye-bye, love. And it's been a pleasure to see the two of you.
OK, Amy, I'll see you in a couple of weeks.
That me done then?
Yeah, that's you done. Thanks very much.
Thank you.
Ta-da.
Bye-bye.
All right, you take care. All right, bye.
Bye. Bye-bye, darling. Beautiful.
Thank you.
See ya. Bye-bye, love.